My name's Courtney and I am one of the HotHealth product experts at Global Health. And today we're going to be going through digital tools in general, not just HotHealth. So HotHealth is just one piece of technology that healthcare businesses can leverage. However, there are so many out there to look at that can run in parallel to software like HotHealth, or maybe even other software that you're running. So firstly, we're going to look at where we are now, what technology is already in place that makes the lives of providers and administration staff easier. We'll look at where we're going, so what emerging trends are there at the moment in healthcare and digital, specifically in Australia. And finally, we'll look at the different types of technology you need to consider when either establishing a healthcare business or if a business is moving from a more traditional to digital form of healthcare and services. So some of these tools have been in use for years in healthcare and others have been in use for years, but not in healthcare. And all of them are really aimed at around improving healthcare outcomes or improving the efficiency of administrative tasks so that everyone has more time for patients and then therefore improving healthcare outcomes as well. And it's something that at Global Health we're really passionate about, is making sure that health outcomes and the patient's health is the center of the technology that we try to provide. So electronic medical records or electronic health records, EMRs and EHRs, along with practice management systems, are often used as either one piece of software or two pieces of software that work really well alongside each other. So practice management systems usually include things like digital billing, digital appointment scheduling and books, and then some form of communication tools for recalls and appointment reminders. So depending on the nature of the services you offer, some PMS and EMR systems may be really complex, all-in-one type solutions, and some more simple and lightweight. So large organizations that we work with often have like an all-encompassing EMR type system. It does everything from billing to medical records and so on, whereas smaller organizations might end up stacking a couple of different systems together to get the features that they need as they grow. So for example, a healthcare business starting out might just start with a software that does client notes and also like email reminders. But as they grow, they decide they need additional tools like secure message delivery, online bookings, and so forth. So those kind of software are specific to healthcare. And then at the bottom here, we've got technology like websites and social media, which are more general. And they're both essential for any type of business. So health services and non-health services alike both need to leverage them. But over the years, there's always been like an ongoing perception that healthcare businesses don't need the same level of online presence that non-healthcare services do. Or we often hear from like specialists or smaller allied health providers that they have a really strong word of mouth system, so they don't need a website. But it's become really clear, especially over the last couple of years, that a website's crucial in establishing trust and credibility with not only potential customers, but also current customers. So customers are starting to leave businesses, whether it's a health clinic or different, for other businesses that have their digital systems established. Similarly, social media is also a core part of consumers' lives. That's not a new fact. And health organizations and clinics really need to consider what platforms their patients are on and where they should spend most of their time. So there's so many ways we can leverage social media to communicate with our customers. Also consider how we can add value to their lives on social media feeds and how that can help to drive interest in your healthcare business. Further to that, we have online bookings. So online bookings and the ability for customers to manage and book their appointments online really changed the administrative landscape for front desk staff. It reduces a lot of that backwards and forwards that you get when you're trying to organize bookings, find a time that you can actually call. When it's online, people can do it from their phones in micro moments that they might have a bit of downtime. So we do get feedback that, online booking systems are not always suitable for all type of organizations. There's some kind of screening that needs to happen before. But there are definitely ways to get around that need by implementing things like online forms. You could turn that into like an online booking form that does the screening for you before having that booking made. The next one here is secure message delivery. And it's another one that's been around for several years, especially in Australia. However, the uptake's been really slow due to limited interoperability or integration between the different secure messaging providers in Australia. And we also find that change management's another big factor that impacts the uptake of this tool. Faxing and what people have done previously is just really easy. It's hard to make the change. It's working, so why would someone change it? So it's a change management effort here to be able to swap to something like secure message delivery. And there's been a lot of work happening in Australia between vendors. So Referralnet and Argus have been two-way interoperable, so they can exchange information with each other for a couple of years now. And the ADHA are also working really hard with vendors to make sure that we can take that next step in being able to exchange information. So SMS and email communication tools are next on here, and it's again something that seems really obvious, but a lot of clinics probably aren't using it to their full potential. So often these type of tools are built into PMS or EMRs, and many clinics use these types of tools to communicate with patients about their upcoming appointments, recalls, calling them back in for results, and other similar things like that. With email, we probably do need to start thinking about, is email the best type of communication tool to use in all circumstances? So whenever patient information is being emailed across a system, we really need to consider if secure messaging can be used instead. And also, aside from patient, I think healthcare businesses can really leverage just being in touch with their patients on a more regular basis, obviously abiding with all the advertising laws that you need to in the relevant industries. But it's something that there's probably a lot of opportunity there for a lot of different businesses. Finally, the last tool we have here is wearables. So the introduction of wearables and in-home devices have really changed the opportunity to deliver healthcare differently. It gives patients the ability to measure certain measurements in the comfort of their own home. So for example, blood glucose and blood pressure devices. And these devices really leave the door open for leveraging other tools in healthcare, which I'll go over now as the trends. So trends for digital health can happen slowly. So health apps in the top graph here has slowly increased in Google interest in Australia over the last 10 years. It's been a slow trend, but it is trending upwards. On the other hand, trends can happen quite fast due to an environmental change. So pre-COVID, that's only a year ago, the level of interest in terms of Googling telehealth was really low. COVID hit. And then since then, it's maintained a higher level than pre-COVID. Trends is a funny one. You might think it's a long way off in terms of having to think about it, but then something can change and it's something that everyone has to jump on board with. So these are some of the trends that if you read the industry news or look into industry magazines, these are some of the trends that they're talking about. So patient apps, wearables, portable provider software, telehealth technology, and also virtual reality. Some of these are linked to the evolution of technology, such as wearables and what that might bring to the industry. And others, like I just mentioned before, are linked to a need, such as telehealth and all the associated technology. So with patient apps, there are so many out there for patients to download on their phone. And a lot of them are niche and specialized in what they can offer. And some of them are also just more general health apps that have a variety of features on there. So some features that consumers can use in relation to their health might include features such as booking appointments, checking into their appointment, seeing their medical history, receiving information from their medical provider, reminders for medications and immunizations, and then tracking key metrics for insights. And depending on what services you're providing, different apps are going to be suitable for different outcomes that you need. Often there might be one that does all of these things, or sometimes you might need to leverage two different types of apps so that your patients are getting the best care possible. And a lot of these, in terms of value to the clinician, are all about enhancing the care and giving your patients a tool that they can use to manage their health so that the health outcomes are better. So growth in wearables is linked to patient apps as well. And I know I had wearables in the current status slide, but it's also a trend as people are starting to use wearables a lot more. So according to a recent report, the wearable medical device market is expected to reach more than 27 million by 2023, which is a jump from almost 8 million in just 2017. So over like 5 or 6 years, there's nearly a $20 million jump in the market there. And although the technology of wearables is already in use, so, Fitbits and things have been around for years, the usefulness is expected to increase in the health industry as we learn how to best leverage the tools. So how can we start to leverage the data that we're getting when someone wears their Apple Watch every day or taking their blood glucoses every morning? And how can we use that to improve the patient's overall health outcomes as opposed to just having the data there in an app and seeing like a trend line? The next one is also, so the next two are kind of related to the COVID-19 and what that has brought about in healthcare. So portable software has always been, I think, some kinds of health providers, so specialists and providers that work in different locations. And that's been around for a little while, but COVID-19 meant that healthcare providers more broadly also wanted this option. So you can host like EMR and PMSs on a cloud so that you can access that from your laptop wherever you are. But now there's a lot of web-based systems that are coming along, which means you can access your system from a web browser. And that essentially means that you can use it on any device that has a web browser, whether that's tablet, mobiles, or laptops or desktop computers. So it's a lot more flexible in the way it's designed. It's usually built mobile first, so the menu options and things are really easy to click on. So as you saw on the slide earlier, telehealth became an essential part of delivering our healthcare in 2020. And of course, you have the typical digital tools for telehealth, such as video conferencing platforms, but there's also a lot of connected tools that come along with offering telehealth, such as digital forms, which allows you to collect information easily from patients when you used to have a paper form. And they both form a large part of telehealth, so video and digital forms. So finally here we have virtual reality. It's a trend that's been on the radar for quite a while healthcare organizations work out how to best leverage virtual reality for workflows and clinical things that are required in day-to-day operations. So it's another one where the market's, expected to boom over the next few years. So some reports estimate it'll be about $5.1 billion in the market by 2025. So it's definitely something to keep an eye on if you're interested in the virtual reality space and what it can bring to your healthcare profession. Part 3 here is the different types of technology and tools that you need to consider when you're going digital. So some of these you might already have, some you might be considering, and some might not be relevant for your organization, or it might not be something that you're really that interested in. So here are just some of the things that you might need. There are more out there. Wasn't going to list all of them on this slide. And then this slide is where where HotHealth and Global Health Solutions can actually help out. So all the orange ones are features where we have a solution to be able to perform that kind of task. And then the blue ones are ones that we either integrate with or we run in parallel to. So in terms of a technology stack, this is an example of how you could stack some different software together. So we've got LifeCard for patient apps, HotHealth, which could cover video calls, digital forms, online booking and websites, ReferralNet, which is secure messaging, Mastercare, our Mastercare solutions, which cover things like billing, appointments and EMRs. And actually some of our Mastercare solutions actually include ReferralNet. So that would actually be one box. So that now you've got 3 tools potentially as opposed to 4. And then on the right here, you've got the tools that you probably need in your business, but it might not be directly related to healthcare. So we've got point of sale, such as Tyro, online accounting software, an example is Xero, social media, depending on where your consumers or patients are spending their time, that might change. And then you've got like Outlook as your email provider, an email tool to send out information to patients that might not be medical specific. So emails that are allowed to be sent. So I mentioned earlier that, being digital is really important in keeping customers. And so this one's here is from a Accenture study. So 90% of health executives believe organizations need to elevate their relationships with customers if they hope to compete. And in terms of digital tools are there to help you elevate those relationships. So to add value to a relationship and help strengthen them. And without some of the digital tools, organizations might fall behind in terms of how they can effectively engage with their consumers outside of the clinic. So that's the end of the webinar for today. For those that like to stay on, I am going to do a quick demo. Alternatively, you can contact us for a dedicated one-on-one webinar demo specific to your organization's needs, or if you've got any questions. If you're not sure even if HotHealth is the right platform, definitely just shoot us an email and we'll let you know if it's something we can help with or not. But yes, I am going to spend probably 10 minutes just going through some of these features here. So the online site, appointment booking, chat, news and articles, events, staff profiles, forms, store, and users. This is one of our demo sites. So I've got two open here. And you can see here that the branding's different. So HotHealth is designed so that your branding is front of mind for consumers. So this means that if you do need to use HotHealth as your website, so for businesses starting out, it's really good. It gives you all the things you need for a basic website. Alternatively, if you have a really comprehensive website already and you're happy with it and it has all the tools you need, you can actually brand HotHealth in the same colors so that when someone comes from your website to your HotHealth platform, the user experience isn't too different in terms of the colors and imagery that they're seeing. So this is just an example of a homepage. You can have all the images are your own and the coloring as well. Then you've just got, your normal pages like your contact page. You can add different locations with different details for each. And also things like your opening hours and relevant items like that. So that's for if you're going to use it as a website, it's got the basic things you need here. The next thing I'm going to go through is your online booking. So to book an appointment, you can log into the site, which means that you'd be able to see all your past appointments and you'd be able to reschedule and cancel appointments as you need. However, it's not locked. You don't have to be logged in. So I can book an appointment here. I can pick if I want in-person or teleconsulting, and I can also filter by a few different options here: location, speciality, and services offered. This is just the next available one, so I'm going to click on that. So on here, we can also add some rules as an organization. So you can add in rescheduling rules, cancellation fees. We're actually integrated with Stripe. So if you do have a cancellation fee and you add it to your HotHealth site, the fee will actually be taken from the patient's debit card or credit card if they do cancel through the site. So we can confirm the booking. You can also add in rules around accepting new patients. So that provider actually doesn't accept new patients. So because I had selected no to have I seen this staff member before, I wasn't allowed to book with them. But we'll select Mary. So if I was logged in, my name and email address would be remembered. But as I'm not, I can input that in. You can add some other identification types, but they're not required to complete the booking. And you can also add in your own appointment terms and conditions here. If you did have fees associated to the booking that you wanted to take when someone books, so more relevant to privately billed clinics and organisations, so not so relevant for Medicare, you can also have that on this page, and someone would input their debit or credit card details, and the payment would be processed through Stripe. But to the patient, they actually wouldn't leave this page. So once I've confirmed that appointment, I can add it to a calendar on my device. which you need to be logged in to do. And you can also go back to appointments and view all your appointments that you've booked. So if I log into one here and go to appointments, I can see some upcoming appointments here. As I'm a staff member, I can actually see what ones have been booked in with me. And if I was a patient, I can see, like this one, what has been booked in. And patients have a similar view, but obviously they can just see their own bookings. If it's a telehealth call, an appointment reminder will be sent to the email address that's been entered in with a link, and they will have the ability to join the teleconsult from this screen. So our teleconsult video technology just opens it up within the screen. There's no other apps that are required. So as you can see, here is the telehealth screen. When the other person joins, they will also be added to this screen. You've got online chat here where you can add attachments. And then we've also got share screen and also a whiteboard as well. So because I'm the patient, I can't actually draw on here. If the provider gives the participants the ability to draw, we can actually. That is the whiteboard. So that's the video consulting part. The next thing I'll go to is chat. So if you have a chat that you've started in a video call like we were just in, that will then be saved once you're logged in this chat component, or you can create new conversations within the chat with either a group of people or as a one-on-one as well. And you can add rules around who's allowed to create chats. So just then I wasn't allowed to create one because I haven't been given the appropriate user level. So you can have it that users can create chats, or just managers of the site can create chats as well. That's up to you. So when I said groups of people, you can have chats with groups of people. HotHealth has this concept of users in groups where you can invite users to be part of your site, or people can join your site. And then you can create groups of people that you can add those users to. And those groups can be used in chat conversations. They can be used in events. So if I create a new event, I can have this viewable by groups, and I can just add the relevant group here. You can also ask for responses and display how many responses you're allowed to have. So if you have an event that you're only allowed 30 people in the event, you can have 30 spots available. Then we can publish that. So once someone can go in here, they can click what they're RSVPing. And as a manager, I can see who's decided they're attending this event and who hasn't replied yet. So if I've invited a group of people, they will be on the not yet replied list, and as they reply, it will be listed out here. So staff profiles, again, this is linked to the appointment booking mainly, but you can create staff profiles with a bit of a biography, their image, and what they're available for. News is the other one where you can use and leverage the groups feature. So if I create a new news story, you can add in your photos, your PDFs, and your text. And again, we can make it private to only a group of people on the site. So this might be useful if you're creating content for paying clients, or if you're creating content for people who have a certain condition, you can use this feature here. Otherwise, you can make it publicly viewable. Articles is a bit different, where it's always publicly available. So it's more content that's always relevant to people. It's really good for your SEO and showing that your organisation is like a thought leader in whatever space they're in, and whatever health speciality that you're in. We've then got online forms. So just moving across this bar. So online forms is one of our newest features in HotHealth. You can create whatever form you want Really, it's all drag and drop. So you can attach files to the form if you need patients to, send through a referral or something they've received. Otherwise, you can just have fields here that they enter out. We can also ask automatic follow-up questions. So if someone answers no, then ask them another question. You can add in your consent items here. So, are you allowed to send reminders and things? So that's recorded. You can then go and update your relevant systems to say that they've consented. And finally, we've got a signature box. So you've got a record of a signature. Once it's submitted, a couple of things can happen. One is that if you just use HotHealth, you'll receive an email that says the form's been submitted, and you'll be able to go online and you'll be able to view the form submissions and download that as a PDF. If you're using ReferralNet, we can actually, or Argus as well, we can add your ReferralNet endpoint as the receiver for a form. So every time a form is submitted through the site, the form will actually be sent to a ReferralNet endpoint, so directly into your clinical system. And we will next month actually be enhancing that feature so that it will be sent as a HL7 RefI12, which essentially means that some of the patient demographic data, such as name, title, address, phone numbers, can actually pre-fill your clinical system if they're set up to receive RefI12s, which most of the main ones are. So that's a really exciting enhancement that's coming, and it's something that will save your business even more time. So eliminating scanning and stuff, and also actually rekeying the information. The final thing I'm going to touch on is the online store. And I'm just going to flick to our demo environment here because I can use a testing credit card to show you how it works. So as I mentioned, you can have fees associated to appointments, whereby someone can purchase something, put in their credit card and actually pay for the appointment when they confirm it. Otherwise, we've got this store. So you can put in physical items, or you can have services and things in here if you wanted. So if I want to purchase this book, again, I'm not logged in, but if I was logged in, some of these details would be filled out. And that will place an order with the organisation. You'll also receive, the person purchasing will also receive an invoice and receipt to their email address that they input into there. So that's the online store. It is quite comprehensive in terms of its features, and we do find that usually most people that want to use HotHealth start using just one or two of the features that are relevant to their business at the time, and as they grow, they might start using a couple of the other features as well. So thank you for joining me today. If you've got any questions, please email us at hothealth@global-health.com. Otherwise, you can visit the website as well.